It started about, 8 months ago. It started to where I couldn't function without having the right amount of oxygen. And I was just working less, and the company I was with let me work a little less. And pretty soon a job that could take an hour would take me 2.5 hours because I'm always resting. I'd only work a minute or two, rest. I went back to my doctor. Dr. Jeffrey Kowitz is my pulmonologist. He started some medicines on me about 8.5 months ago and suggested that I probably get out of that field of work where there's so much manual labor. If I'd have tried to work another 2 weeks and not seek getting out of doing my job, I probably wouldn't be here. It's not easy to be told you got to stop doing something. And as soon as you realize that it is, I was angry for a while. I'm not angry anymore, but I was angry to the fact that where a 6'5", 300-pound guy should not be told you got to stop working, because I feel basically kind of normal. I actually took it for granted because I worked through it for 6 more months. And Dr. Kowitz told me that I shouldn't have. And he said if he'd have known that I'd been struggling that much with, which I tried not to show it because I did not want to quit working. If you like to work like I do, it's hard to accept the fact there comes a time when you say, no, today I'm done. And that's exactly how it went down. I gotta admit, I started to tear up when he told me I had to quit. He teared up too, because he had to tell me. And that was it. I got about 40% use. And it's the bad thing about it is that it's hard to work that way for anybody. But now with the oxygen, at least I can live a normal life. It's pulmonary rehab, and they are set up with the cardiac rehab. So that is where it takes place. It's a 6-week course. And however many people start that class, that is when you will meet them there. We all meet at the same time. You weigh in, and you do your respiration. You do everything. You do all the vitals before you even start. Some places you go, you're a number. I'm not saying it's a lot of places, but going there, you feel like family. You go. He don't try to. Dr. Kowitz, he doesn't look at you like, well, as soon as I run him through, I'm going to be thinking of the other patient. There's no time limit that he will talk to you. He will answer every question effectively, just like family. And his nurse, Stacy, Marissa, at the check-in, everybody, they all treat you like family. You get the smile when you walk in the door. They look you in the eyes and talk to you like family. And personally, that is a big help. I had to do something. And I was so glad to be referred to a doctor that specializes in it. He wasn't here very long before I found him, and I was so glad. If anybody feels that they're having a problem with their breathing, whether they think it's the fact that they smoked and they don't want to see a doctor, it is nice knowing we do have a pulmonologist now in Watertown where I don't have to run to Sioux Falls or Aberdeen or anywhere else where there should be someone. So it was kind of a godsend to have it come right to Watertown. And for everybody that's out there that has been scared to do it, don't lay around home and wait for something worse to happen, because that ride on the gurney is not good.
Prairie Lakes Healthcare System.